to is under the Affordable Care Act, they are supporting the Commonwealth for us to transform the healthcare system that we have from a fee-for-service program towards a program that is really focused on health and prevention and wellness of the population. So through grants that we've been able to receive, community health centers have received over $130 million worth of grants to expand access to primary care, implement electronic health records, and build other infrastructure and capacity. Within the context of some of the waivers that we're working on, we have programs in place to address delivery system transformation. So for those organizations, those providers, to really begin to focus on how to care for the health of a population, the health of a community, and not just when individuals hit an emergency department and need acute or emergency care. So I think the process that we had begun some time ago under Chapter 58, we believe is very much supported by the intent of the Affordable Care Act, and I think more importantly, from a financial perspective, I think as Secretary Shor indicated, in the first year alone, $205 million worth of additional support for that expansion population that will be covered as of January 1st. That number goes to $400 million in state fiscal year 15 and close to $500 million as the federal matching funds kick in all the way up to 90%. So as we had talked about, the ability to have a Medicaid expansion for those individuals up to 133% of the federal poverty guideline, and those individuals who will be offered subsidies from 300 to 400%. And we're seeing, dependent children up to 26 being able to stay on their parents' health care. As Secretary Shor indicated, 60,000 seniors saw an average reduction in almost $700 in their prescriptions last year due to the closing of the donut hole. I think the one thing that we would say is, while we're very positive that the Affordable Care Act will support this journey that we've been on around health reform and changing our systems, we also realize that it's not perfect. There has never been a perfect piece of legislation. And we will continue to work, both in the administration, with the legislature, and with the advocates to ensure that we align ourselves. We already know that we have been given a significant amount of flexibility because of the work that's already been done here. The transition to the rating factors that Secretary Shor mentioned was just one example of that. And I think there is a value and will continue to be a value to Massachusetts for us to continue to be a leader with the support that's coming from the ACA. Much work left to be done, but we're very excited about the opportunity, and we're excited to have you here to ask us some questions about the ACA and what we're doing here in Massachusetts.
Population under 133% of the poverty level, largely moving to Mass Health. There are also people who are not eligible for subsidized health insurance today. As I said, low-wage workers who may have an offer, of health insurance from their jobs that they can't afford. If they are under 133% of the poverty level, they will qualify for Mass Health now.
Thank you.
Some of it.
So that is a very important question. First of all, the Health Connector does serve many ethnic members today, so that is part of the population base that we serve. So a number of things. Not immediately, but in the fall, we will be rolling out our multi-language website. So it's not going to be English alone. This is actually an ACA requirement that marketplaces need to have additional languages for the website. Our call center, that is what we do have today, actually. Our call center can handle really all languages. So there are about 11 languages we actually have on staff, CSRs, that can take those calls. But
CSRs are customer
service representatives, sorry. But there are additional languages that we have backup sources that can provide support. And then we also have a network of what we call enrollment assisters. This is actually a very important part of our outreach and enrollment assistant effort. And these are the people that in the community that can provide culturally, linguistically appropriate support. And let me tell you who those people are. We have current contract in place for that purpose with about 80 provider organizations. That includes virtually all of the community health centers and the majority of the hospitals that are the big hospitals. And then in fact, in the course of the next several months, that number is going to go up to a little over 200. So I would say if you contact your local health centers, they already have trained people on staff who can provide the language service that can provide the information. We also have 10 navigator organizations. Again, if you go onto our website, it will be very clear that because we note that there are 10 organizations that are spread out in the state to support people in whether it's providing information or actually providing enrollment assistance. Again, these organizations, the qualification includes language and cultural capability. And last but not least, Healthcare for All, which is an organization that is working in collaboration with us right now. They are also doing community outreach and education. They are knocking on doors, frankly, in neighborhoods that have high concentrations of difficult to reach populations to provide this type of services. I would say that in the next, it's already started, but it's going to ramp up even further. There will be a lot of community events where we would be actually proactively disseminating information in language and cultural sort of media that is appropriate. Again, I'm sort of coming back to this topic is that today's conversation is part of that effort already, if you look at it that way. Sorry.
That's exactly what I wanted to say, because the Connector has actually been very proactive about reaching out to groups in the different communities. At Healthcare for All, we're going to have a supporting role for those communities that might not have navigators, but they all have community health centers, assisters that can help you in your own language, that can help somebody enroll. The website is going to be very simple. It is very simple already, but it's going to be even more simple than it is right now. But you're going to have somebody that's actually going to be able to enroll you there if you have some problems with the computer, and also telephonic assistance. We've always done that, and I know that you guys, the customer service can help as well. So that should not be a challenge at all.
Last question.
People have access to affordable health insurance and are not enrolled. They are, like Massachusetts, they are penalties you would pay when you file your federal taxes the following year. The tax penalties are not identical to the ones in Massachusetts. They are tax penalties, but they are configured a little bit differently, and they are gradually phased in. Nobody in Massachusetts who gets a federal penalty is going to have to pay a double penalty at the state level. There's going to be no penalty stacking. The Massachusetts Department of Revenue, which oversees our state's tax penalties for people who don't have health insurance, is going to know if somebody has a federal penalty, and that will prevent any penalty stacking between federal and state penalties. So the basic concept is the same. Some of the particulars on the tax penalties are different.
Yeah, so I would always encourage you to come to the Health Connector website.
Exactly. Yeah.
So one of the particular place that I would encourage you to look at is actually I cannot talk about the specific click button, but there will be information resources. There is actually a portfolio of collateral materials from the relatively short ones to pretty lengthy ones, depending on what level of detail you're looking for. This type of information, these materials are also spread across the state, located with our sisters in health centers, and certainly Healthcare for All has a lot of them. We will be distributing them at the fairs that we're organizing. So you will see them. I anticipate that you will see them in places where you see Health Connector presence, but they are certainly available on our website as well. And then again, you should always feel free to just call us. We have a public information unit that we have staff standing by to answer policy questions, procedural questions, and health insurance product questions as well. So do not hesitate help is certainly available.
Do you have the URL for the website and maybe phone number?
The phone number is 1-877-MA-ENROLL. It's actually the same phone number that we have been using for the past 7 years. We're not going to change that. That number is going to triage you to whether it's 1-877-MA-ENROLL.
MAENROLL.
Yes, yes. That's right. We can certainly distribute to that as well. The website is just I think the simple way to do it is just to go to our main website, which is www.mahealthconnector.org. Currently, just for the next 4 days, it's the existing website, but there is a window that looks green that will sort of direct you into what we call a microsite that actually gives you the information that you can access today about what's coming up starting next Tuesday.
Or you can go directly to that microsite, which but Jason, what do you think? Were you going to say something?
Yeah, I was. We'll send out links to you guys this afternoon. And if you have any questions, you can always call me.
That's great.
I'll give you my number right now. If you want to write it down, it's 617-933-3141. So you can reach me there anytime. Yep.
Thank you.
What's your name?
I'm Jason Lefferts from the Health Connector.
And by the way, what Glenn was about to say is there's a microsite called betterhealthconnector.org.
Better MA Health.
MA Health Connector, I'm sorry, but that will get you directly.
We'll send you that link this afternoon also.